Testicular cancer. How are tumor markers used to monitor types? Imagine trying to understand a complex puzzle with clues hidden in your blood. That's exactly what tumor markers do for doctors managing testicular cancer. They are substances found in the blood that give important hints about the presence and behavior of the cancer. The main markers used are alpha-fetoprotein, human chorionic gonadotropin, and lactate dehydrogenase. These markers help doctors figure out what type of tumor a person has, how advanced it is, and how well treatment is working. Testicular cancer is generally divided into two main types: seminomas and non-seminomatous germ cell tumors. Each type interacts differently with these markers. Alpha-fetoprotein is produced by non-seminomatous tumors but is never elevated in pure seminomas. So, if alpha-fetoprotein levels are high, it suggests that the tumor has a non-seminoma component. Human chorionic gonadotropin can be elevated in both types, but it is more common in non-seminomas. Pure seminomas may sometimes cause a slight increase in human chorionic gonadotropin, but they do not produce alpha-fetoprotein. Lactate dehydrogenase is less specific but can reflect the overall tumor burden or tissue damage. Elevated lactate dehydrogenase levels often indicate more advanced disease or larger tumors, but other conditions can also cause its increase. Before starting treatment, doctors measure these markers to help confirm the diagnosis and estimate how much cancer is present. During treatment, these markers are checked regularly to see if the cancer is responding. If the levels go down, it usually means the treatment is working. If they stay the same or go up, it might suggest that the cancer is not responding well or has come back. After treatment, monitoring these markers helps catch any early signs of relapse. It's important to remember that tumor markers are tools to guide diagnosis and management, but they are not perfect. They cannot definitively diagnose testicular cancer on their own because some tumors may not produce these markers, and other conditions can sometimes cause elevated levels. That's why doctors also relying on physical exams, imaging tests, and tissue analysis from surgery or biopsy. There are also new markers being studied, such as specific microRNAs like miR-371A3P, which could improve detection and monitoring in the future. But for now, alpha-fetoprotein, human chorionic gonadotropin, and lactate dehydrogenase remains the mainstays in managing testicular cancer. They help doctors differentiate tumor types, assess how advanced the disease is, monitor how well treatment is working, and detect if the cancer returns. Always remember, if you or someone you know is facing testicular cancer, it's essential to work closely with healthcare professionals. They can interpret these markers in the context of each individual's unique situation and guide the best course of action. Medical management is personalized, and tumor markers are just one piece of the puzzle in understanding and treating reproductive cancers like testicular cancer.